Notts runners are worried that the pandemic could stop some of their number in their tracks. A study by the University of Nottingham found that the athletes have fewer places to train, forcing them to change their running routines. The study is also examining whether running could help COVID sufferers recover from their illness. Na Ching can tell you more.
Like it or not, solo running might be the new normal during the pandemic.
So normally before the pandemic we would run in small groups. Park run was something that was a really important part of my life and lots of my running friends. You know, the socialness of a Saturday morning at 9 o'clock when we'd all meet up and do park run. We've not done that for the best part of a year and we really miss that.
For regular runners, the lack of companionship means they have to be more self-supporting and self-motivated to keep running.
Rather than rely on coaches arranging the running activities, so I had to decide what session to do and where to do it. So more planning and more thought really into where and how I run rather than relying on the coaches.
We have no races at the moment. So if you like competitions and you like races, then you enjoy your training. If there's nothing to race, nothing to aim for, then I think a lot of runners find it a bit sort of meaningless. I mean, as I run for my social needs as much as my competitive needs these days. But for younger runners, I think, especially for children, it's a huge loss not to have that competition.
Working on a study called Running 3, experts from the University of Nottingham also found the runners are left with a few places to exercise due to lockdowns.
You're not allowed to go out into the countryside anymore, a long distance from home. So people are having to change their running. So they're running on treadmills or they're running on the road. And so the surfaces and the terrains that they're running on, that's also going to be impacting them.
By monitoring runners' return to training after the infection, the study also wants to understand if running can help people recover from COVID.
We talked to some people and we've asked them what their level of exercise is. They say, we can't even walk around the house without getting out of breath. Whereas there's some online support groups and there's people saying, actually, I was like that, but 3 months down the line and I can go walk for a mile, I can walk to the shops. From the way that they recovered from long COVID, whether we can suggest recommendations to help other people.
Na Ching for Notts TV.